be fine, y'all. You're going to be just fine.
Kick us off, Michelle.
Hi. Today on the podcast, we are welcoming 3 stars from Bozeman Health. Bozeman Health is our local nonprofit organization. It is governed by a volunteer community board of directors.
That's right. It's the largest private employer in Gallatin County with more than 2,600 employees. We got 2 hospitals, 2 neighborhood care centers, and more than 40 provider clinics and B2 care.
Yeah, it's our urgent care through Bozeman Health.
Thank you guys so much for being here. We have Birgen Knoff, the System Director of Access and Outreach. We have Kelly Reynolds, the Nursing Director at Big Sky Medical Center, and Kim Schellin, the System Director of Nursing and Operations at the Cancer Center. Congratulations, guys. This is mayhem. It's the most people we've ever interviewed on the video podcast.
I'm nervous, frankly. It's fine. But yes, welcome. Thanks.
Let's start with you, Birgen. Bozeman Health has come a long way since it began as a 20-bed sanitarium in 1897. Give us a quick overview of the state of our health system. What do we do well? Where can we stand to improve?
Well, I think we do lots of things really well. One of the things we do really well is emergency care. We have really, really great physicians, great nurses. Our facility is well equipped to handle emergencies, and we've been doing that for a really long time. Our OR services, the services through surgical services clinics, all of those service lines are very, very capable of caring for our communities. Our GI care is top of the line. We have a newly developed health system through behavioral health, and that's one of the things that we're really working on to improve for our community. Behavioral health, unfortunately, is one of those things that has really risen to the surface, especially since the COVID pandemic. And we really are trying to understand how we can better meet the needs of our community through expanding the services of behavioral health.
Outstanding. Plus, it's pretty.
Yeah, I know. It looks nice. I've been spending a whole bunch of time in the interventional radiology center lately. I had a deep flap in another state because nobody here does deep flap yet, but you will. I've heard it's coming. But yeah, that whole team has been absolutely fantastic. Just right on it. The surgeons, the staff, like I know the staff members' first name, and we're buddies now. So yeah, I really appreciate the entire center, even though the Cancer Center is my stomping grounds.
Right.
Speaking of the Cancer Center, and I'm a breast cancer survivor and thriver, all the things. So I understand the Cancer Center has recently added to its oncology team and a lineup of radiation therapy technology.
Yes. Yeah, I sure can. I'm really excited about where the Cancer Center is going. Yes, we added 2 new medical oncologists, a radiation oncologist, a new physicist. We've expanded almost all of our services and are continuing to do some outreach. We have really taken the new LINAC to the highest level we can, and that's radiation therapy with our new LINAC that went live in January. And I think we have one of the best oncology services in Southwest Montana, and we're going to continue to grow rapidly, actually. It's one of those areas that, provides care not just to oncology patients, but hematology patients as well.
But yeah, Justin Thomas is my oncologist, and he's absolutely fantastic and came highly recommended by somebody that I went to see at Huntsman. So, because that's where he did his training. So
nice to find one in your backyard.
Yeah, I know, literally. But yes, it's been a fantastic experience for me. Also, I have a question. I know that you guys were looking to integrate more naturopathic medicine into the oncology center. Can you speak on that as well?
Yeah, we're working towards that currently. What we have added just this last year was lymphedema therapy. And we have added a dietitian now who works with us quite regularly and does frequent rounds in our infusion center, and then has a open door policy on Tuesdays for all patients that are able to come in and see her. So we've added that. We are working at adding a naturopath. We just are taking things slowly, but that will be coming in this next year.
That's exciting.
It is.
All right.
Much needed service for sure.
Kelly, we'll let you talk. Nurses are the foot soldiers of medicine. right? How challenging is it to find and keep qualified nurses in a location like Big Sky?
Very challenging. I think all of the businesses in Big Sky face this challenge as far as housing and the affordability of our staff members to live here, including physicians. It's not just nurses. All the way across the board, everyone has a hard time living here. So we've worked really hard. We have lots of rentals that we manage, and we have 4 condos that we bought when we first opened this hospital in 2015. That was actually supposed to be to have new physicians live in, but now it's workforce housing. So about 65% of the people that work in the building in Big Sky live in Bozeman or outside of Bozeman. Some people travel from Great Falls or
That's
Billings.
incredible.
They'll come and they'll stay for their 6 shifts and then go home for 8. So it was the opposite when we opened. Most people lived in Big Sky and did not commute from Bozeman. So, yeah.
I mean, workforce housing seems to be an issue that people are having across the board. So sure, you guys are no different. Are there any innovations that you're proud of that you guys have implemented there at Big Sky Medical Center?
As far as nursing or?
As far as, nursing goes, or just workflow?
Yeah. We see quite a few traumas throughout our ED. We're a little 6-bed hospital ER at the base of a hill, and in the height of our season in the winter time, we're the 10th busiest in the state as far as trauma. So we implemented a wonderful trauma program here that's run by Cheney Bird and Heather Wicks, and they just do phenomenal work. That was a big lift for us. We got a 3-year designation without any findings last year. So it's kind of rare and exciting. So they did a really good job, and we continue to learn and grow as our community grows.
It was my favorite emergency room experience. No one should ever say that.
It's a beautiful facility for a 6-bed hospital.
Yeah,
it did feel like I had like my own private wing. And so, yes, it is a small but wonderful emergency center. So Bozeman Health was recently recognized for its care of rural communities, which is very important to Montanans. What's your secret recipe there with the rural communities? Also, I have trouble saying rural.
It's a tough word.
I think really one of the greatest things that we have been able to implement and been lucky enough to have broad sweeping support for is our program that really facilitates connecting with those rural hospitals and communities. So we started with a transitional care program, which has kind of morphed into our Access Center program. And that program allows us to exchange patients with rural communities, but really try and provide that care close to home or as close to home as possible. So instead of having to travel to the bigger centers in the state, really try to focus on, can we provide the service for you to be able to allow you to stay a little closer to home? Also providing some consultatory services to those folks who really, maybe they don't have a specialist in, spine care. So we allow them to connect with our physician to really understand, does this patient need to come into Bozeman Health, or could they be cared for in their own community? I think the other thing we've tried to do is create outreach services for some of those smaller communities, so we can send our oncologists into some of the communities that we have here in Bozeman, or our cardiologists, our surgeons, so that they can see those patients either in follow-up or in a consult perspective, so they don't have to travel so far to get that care.
That's fantastic.
Yeah, that's great.
Yeah, I'd like to add a little to that, because I think what we do really, really well is that we integrate into these small communities so that patients that may not receive care or even seek care out because of the travel are able to stay at home and see these providers. For example, with oncology services now out in Dillon, we've really, those patients that may not have been being able to be seen or wanted to go all the way to Bozeman to get care, they're being able to see a provider in Dillon. So I think that's something we've really capitalized on.
Wow, that's fantastic.
Yeah, that's a great program.
Kelly, are you good? Feel like they covered it all?
I think I'm good. I think Birgen especially has taken a huge amount of time to listen to communities and hearing what they're saying, what they want, what they need, and answering those questions and answering that need. So I think that's the biggest thing, is communicating with these rural communities. Like, what do you need? We might not know, but we just had a community gathering here, and it's Obviously oncology was one, pediatrics is a big one that they'd like here. There's so many, and then prioritizing it. It's a huge lift for Bozeman to get those there, but they do it. And I think that's why they're known for it, because they do it. They actually show up and do what they say they're going to do.
I love that. Well, thank you guys for doing that, because we do have quite a few. We, as Montanans with a population of 1 million-ish,
spread out quite a bit.
Communities that need
it's challenging, and Bozeman is growing, right? It's getting more expensive. Some people are being pushed to the edges. What is Bozeman Health doing to ensure that those people still have access to great medical care?
I think that's one of the reasons that we've really expanded our care into the retail health platform. So as you look at retail health, that's a way for folks to access care easily and conveniently. So that idea of convenience care is really where our focus is to broaden the spectrum and our locations. So we do have more locations in Belgrade. We have a location now out at Four Corners, so that some of these communities that are, in closer proximity to those areas are able to be serviced in a meaningful way and not have to come all the way into Bozeman. Also, the idea that you could go online and schedule your appointment and then know when you're queued up to be able to be received. That's so convenient for people, especially people who have kids, people who are trying to, juggle so many different priorities. So understanding that there is a limited amount of service that can be provided at those locations, but we try to focus on the services that are most needed urgently. So those things like, we have vaccination clinics that we try to have out in other communities. So I know Kelly has done a great job in Big Sky of pulling vaccination clinics out to different, services for bigger, communities, bigger areas that may have, I'll just use during COVID when we had, Montage, we had the Yellowstone Club, we had Big Sky Resort, and we would take our mobile clinics on the road so that we could go to them instead of having them have to come to us. And I know we do that in many other communities. We do try to create that space for the beginning of the school year. We know that kids are going to need physicals. So we try to create those clinics so that parents have an ability to schedule into those clinics. They can get everything that they need at that one specific time, because that's a real crunch time, especially for parents who are working.
Tell me about it. Yep.
Very familiar with that. And you talked about going out on the road. Speaking of, you've got one of the most dangerous stretches of highway in America that connects your two hospitals. How does that affect your ability to transport patients between them?
Yeah, transportation is a really pressing issue, not only for us, but really for, I think, nationwide. Because of the way emergency services is reimbursed, it's tough to make a living in that industry. So what we've tried to do is work through the Big Sky Medical Center and our service providers here who do provide those emergency medical response services. We have a great partnership with Big Sky Fire. Big Sky Fire serves the community of Big Sky in a very meaningful way. With that being said, we've routed all of our transportation calls through the access center, so that gives them one point of contact instead of a number of different folks that they have to reach out to in order to facilitate that transportation. I think too, we really respect that passage between Bozeman and Big Sky is a challenging stretch. And so trying to understand on those non-flyable days, how can we rendezvous maybe halfway down the canyon so that potentially, the service that we're providing isn't extending too many different providers for too long a time. So if we rendezvous at the mouth of the canyon, it's 1 hour instead of 2 hours for each of the different services.
That makes sense. Yeah. And that canyon, it's a stretch. It's quite the stretch. I like that you called it challenging. Other people have different terms for it. So your recent foundation gala, which I accidentally came across when our kids were bowling downstairs in the Strand Union. I went upstairs to go to the bathroom, and everybody was dressed. And I called my husband. I was like, everybody up here is dressed like the Great Gatsby. I don't understand what's happening. And then I went into the bathroom and I'm washing my hands beside this other woman. I'm like, I love your outfit. What is this event? And she told me. And I was like, hey, that's great. I'm a former cancer patient. And she was like, fantastic. But yeah, it was, it looked like a whole bunch of fun. So next time I need to be on the invite list.
Absolutely.
I don't have any flapper outfits, but I could find one.
Well, every year it's a different theme. So who knows what it'll be next year.
Good.
Yeah.
Yes. Punk rock. But yeah, tell me what you guys were able to do with that, and tell me a little bit about how much you raised for that.
Yeah, so we raised $870,000. It was the biggest foundation fundraiser they've ever had.
Wow.
It was absolutely incredible. We celebrated last week again, a former cancer survivor as well, threw a little party for us to have a celebration with our foundation, just to say another thank you. So that was great for the entire cancer center to be invited to that. With those funds, it's still up to foundation to help us decide on exactly where that we will be spending it. A lot of transportation, housing for patients that are coming in for radiation therapy. As you know, radiation therapy, you come in and you do sometimes 7 treatments, but sometimes up to 30 treatments. And if you are from Dillon or Big Sky or West Yellowstone, that transporting every day is really difficult. So we provide housing for a lot of those patients. And so these funds that were raised through the gala and the foundation will help offset some of those costs that we endure with that. So that's pretty exciting that we'll be able to serve more of these patients.
Sounds like a good reason to have a ball.
And congrats on that. That is incredible. That's
it's very exciting.
$800,000. All right. Speaking of
nice
exciting,
work.
Joe has something exciting.
Okay, yes, we're done with all the questions. We're done grilling you guys.
No more red tape.
And now we're to the fun part. So the idea is that you have to pretend that Bozeman got its own medical drama. All right, and you guys are overseeing it. It's called St. Bozeman Big Sky Hope's Anatomy 911 ERMD. All right?
Yeah, it's succinct. Okay.
We will read potential lines from the show, and you basically have to select which one's the most like Bozeman-y. Okay. All right. I think the first one will be a good example of what we're talking about. A line from the show. Your daughter was very fortunate. She would be dead if she had taken one more blank. Okay. So now Michelle is going to give us a dramatic reading with the possible lines.
Oh, dramatic. Yes.
Yeah. Dramatic, Michelle.
Your daughter was very fortunate. She would be dead if she had taken one more ride on sourdough and her roller skis.
Here's your first option.
First option. Second option, shot of Jason.
Read the whole line.
Okay. Your daughter was very fortunate. She would be dead if she had taken one more shot of Jason Momoa's new vodka, Melee. Third, your daughter was very fortunate. She would be dead if she had taken one more bite of that. This is too soon. Morel mushroom roll.
All right. See which ones you guys are in charge of the show. Which line are you going with there?
I mean,
I got to go with the first one. That's a really dangerous stretch.
Go with the first one. Yeah. Sourdough.
Yeah.
Sourdough and roller skis.
We live out by all that, and I won't run on it anymore. I'm like, I'm just gonna get hit by a car if I do that.
All right, this is what it's like to be a TV producer, guys. You're putting yourself in my shoes. All right, here we go. All right, here's the second line. I've never seen a diabetic coma this severe. Apparently, they found him collapsed behind blank. All right, Michelle, take it away.
I've never seen a diabetic coma this severe. Apparently, they found him collapsed behind Main Street over Easy. He ate almost half of a cinnamon roll by himself. All right, so I've never seen a diabetic coma this severe. Apparently, they found him collapsed behind La Chatelaine, not the one on Main, the one on Rouse, where the chocolates are freshest. Okay, and 3, I've never seen a diabetic coma this severe. Apparently, they found him collapsed behind Granny's Donuts. I'm just surprised he found a time they were open.
Oh, that last part. I think you got to go for number 3. I don't know, Kim. What do you think?
Wow, you're feeling bitter.
Granny's.
They're the best.
Yeah,
hard to go wrong with Granny's.
Yeah.
My kids are obsessed with like going and getting the dip, the sprinkle dip.
I do like the over easy cinnamon rolls though. I'll take those too. Those are pretty good.
I know.
Best
It's
in
fine
town.
to split it. Yeah.
All right, here we go. Third is, I'm calling it time of death 0942. That's how you medical people talk. Cause of death blank. All right, Michelle.
I'm calling it time of death 90942. Cause of death swimming in a recreational pond during a toxic algae bloom.
There's your first.
All right, that's my first one. 2, I'm calling it time of death 942. Cause of death choking on a tater pig sausage. And those would be from Sweet Pea. For those. And then 3, I'm calling it time of death 0942. Cause of death spending time in the Walmart parking lot after dark.
I think we gotta go with 3 again.
I know. I know. I had to go
A
there
dangerous
recently late
place.
at night, and I was like, what have I done with my life?
All right, we've only got one more. You guys are doing great. You deserve a coffee. Your PA is going to bring you a little snack just to recharge you so that you can finish out the day strong. Last one is code black. I need help with a patient who's threatening to blank. Go, Michelle.
1, code black. I need help with a patient who's threatening to peel her Keep It Wild sticker off her late model Subaru Outback. There's that. 2, she also should probably have a dog named Bridger. 2, code black. I need help with a patient who's threatening to open a decent Chinese restaurant.
Oh, can't
I
have
don't
that.
know. There's
This
one
is-
in Belgrade we like.
This is Bozeman. We're not allowed.
Fine. Code black. I need help. This is 3. Need help with a patient who's threatening to stay in the hospital forever because the view is so good.
Ooh,
Mm-hmm.
we have some of them.
I'm saying 3 again.
Awesome. 3.
3 squares,
All right.
Okay, cool. That
Good
makes
enough.
sense.
Thank
That
you
makes
for
sense.
playing along, guys. That was silly, but very fun for me to write those, for Michelle to act them, and for you guys to select them. You guys were awfully nice to
Thank
spend
you.
some time with us on this. We had Birgen Knoff, Kelly Reynolds, and Kim Schellin.